She's
We
small.
just got it lined up perfectly.
All right, give me that.
Well, should I be picking a side?
That looks good.
Yeah, that was good. Everyone's been really responsive. I think governor's office and but
I would smile.
I feel like we should make conversation.
Why don't you talk about Jeff?
we should make our own comments.
Oh, jeez. Personality types come out in situations like this. Like some people really fly in and shut down. Some people goof around. Like it's all just.
So should I take a picture?
I took a picture of
Take
them.
a back picture back.
I'm gonna take a picture of
Do
Jim
it.
taking a picture of me.
Mr.
You
Camden.
cannot use that one, Jim.
Oh, yeah, up here, you can use it. You can use it. That's, he's just a good idea. He's just a photo guy.
Yeah,
He's
right.
just a photo guy?
The editor, his editor's gonna decide.
Yeah.
Look at that.
Right.
You guys are very
Well,
photogenic.
I said, don't, you can't take a, I said, I'm taking a
was taking a
picture of
picture.
Jim taking a picture of me, and then I said, but you can't use it. And he said he can't control that.
Try to say something.
I think I'm getting in trouble.
John, just to echo, I think we all feel really good about the effort that you're putting in and the effort that your staff
Yes.
is putting in. Like we feel, as we're fielding all this stuff from our constituents, that you're doing a great job.
Yeah.
I think it's been clear too, the emails of what they need. It's like in red and highlighted. You just can't miss this.
Who is it?
I wish we weren't at the center. I do too. I mean, we don't wish we did.
Came out too early.
Yeah. That's true.
You got trouble.
At least,
You had to wear your husky shirt for this.
with Fred. Yeah,
It's just what I travel with. So
it's true. It's true. I feel like
my son might be going to Wazoo.
it's the reason.
Really?
It's the reason that we have it all.
What's he want to go into?
It's true though, that constant.
Doesn't matter at this point. Probably business actually.
Awesome.
Well, we should definitely, I feel like if there's a way to communicate that gives the information, is transparent, but doesn't, we don't want to incite fear. But that,
This testing issue is going to happen across the country because people are getting kids. And so they're going to start testing. And so they're going to find out because Facebook and Thursday now has the testing.
So where did they put them?
But you know, I think so Monday,
Yeah. Jim Kemsley? Jim Kemsley is like a legend. He's like that. But tell him you don't want to know. He's been.
Kim's like, I'm done with this.
Right. I was talking to because one of them was in Nebraska, and I was talking to some, or Kansas. I could do a couple of Midwest. I think they said it was still there.
Do you recognize any of those disorders?
Yeah, it was right through.
Where? Where's Rachel?
Is she Yakima?
Yep, yep.
AP. She used to be on the floor.
It's not isolation.
Oh.
They just
Your guys were
Political, national.
I recognize
Organized Yeah, it has nothing to do, you don't have to be a fan of it. You know what I mean? I'm trying to think about it. I'm trying not to think about it. I mean, I could probably get there and back in 2 minutes. It's a 2-minute vote. We just have to make it from the floor for constituents in Saturday Hall, because that was the introduction.
And be healthy.
Yeah.
Stay home if you're sick.
And if you saw in our split screen, as we call it there, our photographer gave a
2-minute warning.
2-minute warning to the camera. So instead of tossing the break, I think we should keep it here because if we go to break now, we're likely to miss the front part. Vice President Mike Pence at Camp Murray flew out today. As he got off the plane and was greeting people, it was very noticeable. He did not shake any hands. He did the old
Boom.
elbow bump.
Yeah.
It's sort of, you can call it the barbecuer's handshake. You just do that and don't spread.
It'll be very interesting to see what he has to say. As you said, he's heading up the president's task force for the effort across the country and how to handle the coronavirus. So after meeting with Governor Jay Inslee and health experts here who are in the front lines of the biggest outbreak in the United States, it will be interesting to see what he says. And then on the heels of that, what the president then has to say to the nation based on what we learn here, what the vice president brings back to Washington from this meeting today.
Yeah, Mike Pence's boss, President Trump, took some criticism yesterday because he directly contradicted the health experts' statistical analysis that 3 to 4% of people who get coronavirus will die. The president was saying that he didn't believe that and took quite a bit of criticism for it. And so, our commitment to you is to let's talk to the experts, let's talk to the scientists and get their professional opinion on what to believe and what not to believe.
Yeah, it's really not about politics. It's really about our health and safety. And so we're going to continue to bring you the facts as we learned them from the scientists and the health professionals so that you can stay safe and keep your families safe as well. So here is the Vice President, Mike Pence, and I believe he's flanked there by Governor Jay Inslee. Is going to be bringing us up to date on the briefing that he's just had with basically our state's top leaders who are at the front line of the coronavirus outbreak here in Washington after our state has reported more deaths than any other state in the country.
Welcome to Washington State. We've just finished very productive meetings with the Vice President. We in Washington are very appreciative of him being here today. He not only helped us with some issues today in our partnership with the federal government, but he has already helped us in recently removing some federal restrictions that would have made it more difficult to have testing for the coronavirus, which we appreciate. We had very helpful meetings talking about our ability to increasing the testing capacity for the virus in the United States. We had some great discussions about some of our unemployment compensation issues to help more people who might be quarantined to be able to have assistance. We had discussions about the ability to have additional surge capacity in our medical delivery system and our ability to have immediate help from the federal government with one of our nursing homes and other capacity. And I think that he has been very remarkably adept at fielding our inquiries, and I know he's going to go back and help to continue this effort. I also want to compliment his agency directors who have been assistants as much personally to me, giving us some additional scientific information. So I think we have a good partnership between the state of Washington and the federal government, and I'm very appreciative of him being here in such short order. Thank you, Mr. Vice President. Thank you.
Thanks, Governor.
Thank you, Governor Inslee, and to your outstanding healthcare team, Dr. Weissman. It is good to be here. Washington State is on the front lines of the coronavirus in America, and the people of Washington State should be proud of your state and local leadership, the healthcare leadership, the first responders, the way you've come alongside families that have been impacted has really represented the very best standard of care, and all of America's hearts are with the people of Washington State today. Governor Inslee, as I told you, President Trump wanted me to be here to ensure the people of Washington State that we are with you and that the full resources of the federal government will continue to be brought to bear as people across the Seattle area and across Washington State deal with the coronavirus. I do want to commend Governor Inslee, your team's effort, and the seamless partnership that was forged from the very beginning between our administration and your administration here at the state level. Dr. Weissman just informed me that he literally speaks to the head of the CDC every day, multiple times a day. We've had personnel on the ground literally since the first corona case was detected here in Washington State. And President Trump wanted me to be here to talk to the people that are on the ground, the emergency center earlier today, to talk to policymakers here to ensure that we continue to provide that level of support. I'm also pleased to be joined by so many members of Washington's delegation to the Congress of the United States. The good news was today that the United States Senate passed, as the House of Representatives did yesterday, legislation that will provide nearly $8 billion in support. And I want to thank these members of Congress for their efforts, swift and bipartisan, exactly what the American people would expect in a moment like this in the life of our nation. The resources, Governor, as we discussed, are not simply resources for federal agencies, but rather there is also considerable investment available for states like Washington that are dealing with the coronavirus, and also local healthcare providers. And we're truly grateful for their efforts. We have, as the governor just said, forged a strong partnership between the federal government and the state government, and we'll continue to look for ways to strengthen that in the days ahead. So I stand before you today. At this moment in time, we have at least 150 cases of coronavirus in the United States, including 70 confirmed cases in Washington State. Among the balance of those, some 49 are Americans that we returned home from China and from being on the cruise ship Diamond Princess. And of course, as we stand here today, our hearts grieve the loss of 12 Americans, and particularly to those families here in Washington State. Please know that you have the condolences of every American, and you're on our hearts for your loss. While the coronavirus has spread in the Seattle area and new cases are detected around the country every day, the good news is that the vast majority of all of those who have contracted the coronavirus are recovering and doing well. The truth is that the risk of contracting the coronavirus to the average American remains low, according to all the health experts that I have here with me today and that are a part of our efforts at the national and state level. And while there may be more cases detected in this state and around the country as we continue to expand testing, most cases, the experts tell me, will be mild, will have flu-like symptoms, and the Americans involved will fully recover. We have observed, as you have, Governor, here in Washington State, though, that seniors and Americans with underlying health conditions are particularly vulnerable to serious disease, and especially following the heartbreaking loss of life at the nursing home in Kirkland. We've taken action to address that, just as you have here in Washington State. The director of the Center for Medicaid and Medicaid Services, Seema Verma, is with me today. And this week, at President Trump's direction, we raised the standards for all nursing homes in America with regard to guidelines for preventing the spread of infectious disease. And also at the President's direction, all 8,000 of our inspectors at CMS nationwide will be focusing all of their inspection efforts at nursing homes on compliance with federal standards for preventing the spread of infectious disease. We want to make every effort to ensure that our seniors in our nursing homes are as safe as possible from the spread of the coronavirus. And on the subject of testing, we've been making steady progress. And I was encouraged to hear, Governor, that CDC has been able to provide kits to Washington State to meet your demand, but we know that while we're meeting the demand of cases we know about today, we still have a ways to go to ensure that tests are available for any future cases and also for people across your state and across the country that may be concerned that they had contracted the coronavirus and want to obtain a test. But I'm happy to report and have you confirm that the CDC has prioritized the delivery of coronavirus test kits to Washington State and to California, and I can assure you, Governor, we will continue to do so. But by the end of next week, CDC's test supplier, a company known as IDT, will distribute kits across the country that will enable roughly 1.2 million Americans to be tested for the coronavirus. Those kits will be delivered in just a matter of a few days. By the end of next week, another 4 million tests will be available. But it's still just a beginning as our nation continues to hear of new cases every day. We want to make sure the testing is available broadly. And to that end, President Trump brought together the leaders of the top commercial labs in the country. And as we speak, at the President's urging, they have formed a consortium and will be working with the leading commercial labs in America who tell us that in a matter of weeks, through validation efforts that we'll do through the FDA, they could well be in a position where in the not distant future, your doctor, your local pharmacy, your local med check will have access to a coronavirus. We have a ways to go, but President Trump said early on that we would bring a whole of government approach to confronting the coronavirus, and we have. But as the President met this week with the leaders of commercial laboratories, with the leaders of pharmaceutical companies, with leaders of other industries, the truth is we're bringing a whole of America approach to this. And American businesses are stepping up in new and in renewed ways to make sure that we have the resources, including the testing and the development of therapies, and ultimately in a year and a half, we hope the development of a vaccine for the coronavirus, and every American should be grateful for that. With regard to the tests themselves, once again, CMS has already made the changes necessary that a coronavirus test is today now eligible for coverage under Medicare and Medicaid, and we'll be working with these members of Congress to ensure that coronavirus testing is included as an essential health benefit and therefore is covered by all the private insurance in the country as well. There may still be gaps. We'll work with policymakers to ensure that the coronavirus is available for anyone who is concerned or is suspected to have been exposed. But we're making great progress in ensuring that this test is available broadly to people across the country. For up-to-date information on the status of the coronavirus, on best practices for preventing its spread, keeping your own health and your family's health secure, you can go to coronavirus.gov for the latest information from the Centers for Disease Control. Our message to families all across the state of Washington is simply this: we're with you. We are here to help, and we're going to stay with you every step of the way until the state of Washington and America sees our way through the coronavirus. We are making progress. As I mentioned, federal assistance was approved by the United States Senate. President Trump is expected to sign the legislation tomorrow as he visits the CDC in Atlanta. In that same spirit, I'm grateful to report that on Air Force Two today, through the efforts of HHS, Governor, we've delivered 100,000 N95 respirators, over 100,000 surgical masks, more than 2,500 face shields, and thousands of disposable gowns and gloves to assist in making those resources available And also, we're truly grateful that a leading research company made more than 200 doses of an experimental therapeutic medication available for people that are struggling and having severe difficulty with coronavirus. And we have a commitment that those medicines will continue to be made available on a daily basis. With that, I'd like to introduce the head of the Centers for Disease Control, Dr. Bob Redfield, for the latest information and your best counsel of the people of the state of Washington.
Thank you very much, Mr. Vice President. First, what I would like to say is that I am really grateful to be here to express CDC's appreciation for the dedication and efforts of the public health community and the people here in Washington as you begin to confront and continue to confront this outbreak. I would also want to underscore what's important to all the citizens of the state. I want them to have great confidence in the judgment and leadership of their governor and their health department. Right now, the state of Washington is really, as the Vice President said, it's the tip of the spear. And we are all here to commit our CDC's full support to assist you and work together to confront the challenges that this brings. We implemented at the beginning very aggressive public health measures together to try to slow the spread in our country. You're now at a stage where we're beginning to see community transmission. And I just want to say again that it's a privilege that we have at CDC to be able to partner with really the strongest public health system that we have in this nation within the state of Washington. We need to continue to be committed to the importance of early case recognition. And I want people to realize that when new cases are identified, that's actually a success, not a failure. It shows that your public health community is out there doing their job with isolation and contact tracing. And as we have one of the challenges to understand, how do you really understand how to impact this virus for individuals that don't actually have symptoms? I will argue one of the most important ways to do that is to practice public health and do early case recognition, isolation, and contact tracing. It's through the contact tracing that you're going to begin to identify that group. I also just want to finish by saying that we're here in partnership with your health department to actually learn, because this state is now, as I said, the tip of the spear. As we begin to reinforce those control measures that we just talked about for containment, but begin now to implement different mitigation strategies in the population. And I'll close by just re-echoing what the Vice President said, that the overall risk of coronavirus to the American public at this point is low. We're here to work in partnership to help the state of Washington begin to effectively continue to address as we confront the community spread that's here. And again, I want the individual citizens of this state to recognize and have the confidence that they have, in my view, the best public health community in our nation to lead this effort. Thank you very much.
Governor Inslee, as the President said, we're all in this together. And I'm truly grateful for the opportunity to spend time with your team, to have the opportunity to spend time with Mayor Durkin, with King County officials, to hear a report from the ground. We have a ways to go, but I know we'll get there together, and I know that we will continue to build on this seamless partnership between the national government, your administration here in the state of Washington, and all the extraordinary health officials, healthcare providers, and first responders that each and every day in the weeks leading up to today have been there, the people in this community. As the President likes to say, this is an all-hands-on-deck effort, and we'll continue to bring the full resources of the federal government to support your efforts in the Seattle area and across the state of Washington. And we'll get through this together. Thank you, Governor.
Thank you. You going to stand for some questions, Mr.
Absolutely.
Vice President?
Certainly.
Mr. Vice President?
Yes, please.
Can you talk about the federal agencies of the nursing home family members held a news conference today and had harsh criticism about the government's response thus far.
Well, let me say again, our hearts go out to the families of those who lost their life at the Kirkland Nursing Home. And I'm going to recognize Seema Verma, the administrator of the Center for Medicaid and Medicare Services in Washington, D.C., to speak about our efforts. But not only have we raised the national standard, but we're engaging in a very fulsome investigation in connection with, cooperation with the state of Washington to find out and to get to the bottom of what happened. But I want those families to know that our hearts are with them, and we're going to continue to work diligently on behalf of ensuring that that facility is safe and that all nursing homes in America are safe. Seema?
Thank you. As the Vice President said, our hearts and minds are with the families and the folks that are at the Kirkland Nursing Home. I will say this is personal for all of us. In my family, I have a 70-year-old, 80-year-old, and almost 90-year-old. And when people put their families in a nursing home, that's a tough decision. And they want to know that their loved ones are safe and they're secure. So in terms of what our response is we're working with the state, and the governor and his staff have been terrific. The CDC is on the ground, they're in the nursing home, and they're investigating what's going on. We will also send in a team from CMS, and we'll be looking at what the course of action is and whether we need to, how we address the patients that are in the nursing home. And we're doing that in conjunction with the state, so we'll be making that assessment over the next couple of days. But I will tell you that our focus is on making sure that the patients that are in the nursing home are secure, they're safe. We're working on getting everybody tested in the nursing home. And the other thing that we're doing is we're not just stopping at this nursing home. We're taking a very proactive approach across the entire nation. The first thing that we've done is we've put out guidance to all of the nursing homes, explaining to them, or re-emphasizing infection control policies and procedures. Every facility in the United States has infection control policies. These have been long-standing policies and procedures that are in place, and so we're re-emphasizing those. There's training, free training available for all facilities. That being said, we are also taking the nation's inspectors and having them focus particularly on infection control. So we're going proactively into nursing homes. And our goal here is not to be punitive, but to help them be prepared for what may happen and to hopefully prevent the spread of the coronavirus.
Other questions?
Mr. Vice President. Mr. Vice President.
Yes.
You talked about the infection rates being low. Mm-hmm. The World Health Organization came out this week, as you know, and said the mortality rate is 3.4%. Mm-hmm. Yet the President of the United States said yesterday that those numbers are false and that he has a hunch the numbers will be significantly lower. Do you agree with the President's assessment?
Well, let our expert, Dr. Deborah BIRX, address that. I think the President's point was that the world is still discovering the scope of the coronavirus, because many people that contract the coronavirus have no symptoms. And evaluating the data that we have from China, from Italy, from South Korea, I know the World Health Organization has a number at this point, but I think Dr. BIRX, who is our right arm at the White House on this, and frankly one of the leading experts in the world on infectious disease, I think is looking at those numbers every day. You want to speak to that?
Mr. Vice President, do you agree with the President's assessment? Straightforward question.
Well, let me let Dr. BIRX. I support the President's judgment that we're going to continue to learn more about this, and that as we learn about how many people actually contract this disease, Dr. BIRX, I think your judgment is we may well arrive at a lower number. But allow me to let you speak to that.
Yeah, thank you, because it's a really important question, because it's an important question for the public. We know the public is concerned. Everyone who's a mom, a dad, who has a grandmother or a child is concerned about the numbers and what it means. As we get numbers country by country, we've been able to see in countries like South Korea, where they're doing broad testing, So they're finding the mild disease, the moderate disease, and the severe disease. Their mortality is in the 0.5 range, which is significantly less than the 3%. The 3% is concerning to all of us because we really want to understand where the virus is spreading, who we have to protect, who's the most vulnerable, who needs access to these novel and new development therapeutics. And so we can really help resource and focus our energies where we know that the epidemic could have the largest impact, which we know from Italy, the median age of people who succumbed to the disease was 82. The numbers that were found to have the disease were in their 60s, which means they're still missing a lot of low-grade disease in younger individuals. The good news from South Korea at this point is they haven't seen mortality or people dying or children dying. Not in China, no one died under 10, and in South Korea so far, no one under 30. But these numbers will continue to change, and we want to really emphasize again that not only are older people vulnerable, but people and young children that may have immunodeficiencies or other diseases also have to be protected. And so that's why we're asking communities. These kinds of problems are solved when communities are working with state and local governments and federal governments together with one voice. And together, we're translating everything that we know down to the community level so people can make decisions for their families. And so right now, the spectrum, the average is what you said, but I don't like averages. I call them the tyranny of averages because it lumps everybody together. And what we want to understand is who needs our help the most and how we prevent future deaths in this disease.
If the mortality rate does stay at 3.4%, what do you have in place, plans in the future to stop the spread of this virus?
Well, I think two things that really are important. One, the president held a meeting with pharmaceutical companies to really see who had promising therapeutics. So we're looking at this as a bridge. We know we need a vaccine. We know it's going to take a matter of months to a year and a half potentially, depending on how difficult vaccine development is. But we heard from companies that were making therapeutics that they're in trials right now here, right in Seattle area, to really look at a promising drug to see if it could help change that mortality number. There are also companies talking about what we call monoclonal antibodies. Those of you who are older remember getting an injection of immunoglobulin before you traveled overseas. It's capturing that in a new technology to really see if that's, again, a bridge to prevention as well as treatment. So all of these are being explored in a stepwise manner to really get to what we all want, is decreasing the mortality from this illness. But we won't know the numbers that you ask about until we really understand the depth and breadth of the illness in communities like this. It's why we wanted to come here.
Mr. Vice President, of the $8 billion that's been appropriated by Congress, how much of that money will come here to Washington State, the epicenter of the epidemic?
Well, I can tell you that it was a priority for the President, that we not only support federal agencies in this legislation, but that we recognize the vital importance of medical supplies, the state response, that we fund research and development, that we continue to fund vaccines, as Dr. BIRX just said, the development of therapeutics, which we believe will be available much more quickly than vaccines, which could be another year and a half before they've been fully tested and approved. At this point in time, about $3.1 billion will be made available in the legislation alone for the purchase of medical supplies, and those, of course, directly benefiting state and local health authorities. But there's some assistance for small businesses that are impacted, like in the Seattle area, and I want to commend these members of Congress for the swift and substantive and thoughtful and balanced approach that they took to passing this legislation. We think it is a reflection of really the very best of what Congress can do for the American people, and to do it as swiftly as they did. The President and I are both grateful.
Mr. Vice President, dollar figures, any specific dollar figures from anyone there?
Essex, the Vice President has assured me that this will be distributed entirely fairly, which means 50% for Washington and 50% for the rest of the nation.
Governor Inslee, a question to you. Jeff Mason with Reuters. You tweeted last week that after a discussion or during a discussion with the Vice President, you told him that your work would be more successful if the Trump administration stuck to the science and told the truth. Do you still feel that way, and did you raise that with the Vice President today?
No, we didn't talk about that today. I think everybody agrees here that we want to have the best science. I think there's a unanimous opinion of everybody here today in that regard. And I do believe that's very important going forward. I want to tell you, I think we are hearing good science. Dr. REDFIELD has helped us out. Dr. Fauci, who I spoke with this afternoon, has provided us some really useful information. And I think that's very helpful to us. We're getting good information from the agencies of the federal government, and we appreciate that. I know there's this issue about the mortality rate. I just want to suggest that we do not have the luxury of having debates of that nature right now. We all agree that we need to ramp up dramatically our ability to find this disease and get more tests in the field. We all know we got to have at all points on hand to increase manufacturing for our personal protective devices. We all know that we have to have a very vigorous effort to try to develop a vaccine as fast as humanly possible. And I'm just pleased that I think we have good consensus about those things. So we got to roll up our sleeves, and I think this has been a good day to do that.
Thank you, Joe. The Vice President had a lot of nice things to say about your response. I'm sorry? I said the Vice President was very complimentary of your response. I'm just wondering, how would you judge the response by President Trump?
I'm going to defer the answer to that question to the Vice President. Look, I have had more than a very robust disagreements with the current president, but I want to focus today on the work we need to do in a partnership. And I can tell you that I think that this is a good partnership moving forward. I think that we have a very good partnership with thousands of people in the federal government, and we're not going to allow some disagreements with any one individual in that government to dissuade us from doing really important work that are life and death issues for the people of the state of Washington. And I'm pleased with the results of our collaboration today. That's what I'll tell you.
Can I please get from one of the medical experts? Testing, please. We expect more testing, right, with the ramped up capacity. With that, there's research that suggests that we'll see a lot more positive tests. What can you tell the American people, the people of Washington, about what they should prepare to see and why they shouldn't panic when they do?
I'll speak to that.
We will see more positive tests. And that is a really critical point, that we have more detection, because this will give us real information, and that's really why we're here. We know that this particular area is suffering. You saw the really difficult issues of the elderly and the frail succumbing to this illness. We do believe on the other side that there are people with mild illness, and unless we find them also and understand where they are, it will be difficult to change the transmission dynamics. So we're very interested in finding every case, sick or not sick, so that we can understand how this virus is transmitted. Early on in epidemics, and it's only been 2.5 months, you only see the most desperately ill, because those are the ones who come forward. Those are the ones who are seen. We want to see those behind that we can only find by testing. And so the American people should actually be encouraged when we find mild cases and we find more flu-like cases, because it will give us a real understanding of how to better respond to the epidemic.
All right, thanks, guys.
Thank you all very much.
You've been watching live coverage. The Vice President, Mike Pence, in town meeting with the top health officials in Washington, also members of our congressional delegation, and Governor Jay Inslee, talking about the partnership between our state and the federal government, and hearing the Vice President say, quoting now, "We're bringing the whole of America approach. We're all in this together." The President wanted him to come here so that the state would feel supported and to ensure people of our state that quoting now, "We are with you, and you will have the full resources of the federal government as you need them."
And part of those resources are a lot of money and a lot of availability and permission to start doing a lot more testing. With that testing, it's good news, as the doctor said, because that lowers that mortality rate to a degree, but it also means the numbers will tend to go up.
And about the testing, we heard the Vice President say that over the next week, about 1 million tests will be available, and then a week after that, 4 million more tests will be available. So Chris Daniels is there at Camp Murray in Tacoma. You've just heard all of this. It was a lot of information that came out and some great questions you posed as well to the Vice President. So Chris, bring us up to date. What did you make of this press conference?
Well, a couple of things that came out is that Vice President Pence says that millions of coronavirus tests will be rolled out throughout the United States, a large percentage of that in Washington State here in the next week or week and a half. He said by the end of the week, I believe the number was 5.2 million different tests that should be rolled out nationwide. There is also a new set of standards for nursing homes, as you know, and we heard here that has been an epicenter of the outbreak in Washington State with the Life Care Center in Kirkland. He talked a lot about that. He talked about the aid package that was passed by Congress and will be signed by the President tomorrow to get more equipment like we see here behind us rolled out here into Washington State. Those were some of the highlights. We also saw a direct question to the Vice President about whether he agrees with the World Health Organization and the mortality rates. He kind of sidestepped that question and said that as these tests come out, that he believes that the number could go lower. But there was a significant news, and one of the things that is striking, both being in the room when they started this meeting and also here at this press conference, is in such a divided country with such partisanship, there was really a bipartisan tone. We saw a lot of nodding from people representing all sides of the aisle. We saw Pence striking a very bipartisan tone, talking about how the federal government is with Washington State. So that is one of the other things as well. When Governor Jay Inslee was asked about that question in one of his previous tweets, he said he didn't want to talk about that today and wanted to talk about what's doing best for Washington State. We do have a soundbite, a statement, I should say, from Vice President Mike Pence and what he said here on the podium. Let's go to that now.
President Trump wanted me to be here to ensure the people of Washington State that we are with you and that the full resources of the federal government will continue to be brought to bear as people across the Seattle area and across Washington State deal with the coronavirus. I do want to commend Governor Inslee, your team's effort, and the seamless partnership that was forged from the very beginning between our administration and your administration here at the state level.
One of the other numbers that the Vice President threw out there, 100,000 N95 masks that will be getting rolled out. So he talked about the testing numbers and the fact that those numbers of positive tests could likely go up dramatically here in the next few days. That would be an example of the test being put out into the community and the chance for people to take that test, that is perhaps a positive sign to learn more about this coronavirus. Obviously, there is still a lot more to learn. Back to you from Camp Murray.
Before we let you go, Chris, I think it was really important because we heard the head of Medicaid, the director, talking about raising the national standards for nursing homes. I was particularly struck when she said it's really personal for all of us. A lot of us have elderly parents or grandparents who are in nursing homes. So raising these national standards to try to keep people who are elderly most at risk for contracting this safe, that's pretty significant news as well.
Yeah, and that was what I alluded to with the nursing home standards. Obviously, one of the things that came up here, one of the questions to the Vice President was about the Life Care Center in Kirkland and the concerns that he was not visiting there. So that was one of the answers, that the standards for nursing homes, how they're cleaned, how they're governed, are going to rise as a result of what we have already seen here locally with the coronavirus, the COVID-19 outbreak. So there are still going to be things we're going to learn about coming out of this, but that's what we know right now.
Hey, Chris, did you get the sense from the Vice President that things are going to get quite a bit worse? It sounds like they're preparing for something that's going to be much bigger than it is now.
I think if you talk to medical professionals, if you talk to the scientists, and you heard it from the Vice President, we now have tests in Washington State. They started rolling out, the standards from the CDC started rolling out last week. Now that we have testing equipment, now that we have the material here in Washington State to test for coronavirus, those numbers, I think we can safely say, are going to go up in the near term. It's just a matter of how high those numbers go up. But that is a key aspect, is to get these tests certified by the CDC. There have been some problems with that, as you know, on a federal level. Now that they're here, now that we'll have a chance to test, I think that we will see those numbers go up, and we'll learn a lot more about just how this virus spreads.
We'll hear a lot more from you later today. Chris Daniels reporting live from Camp Murray, there with the Vice President. Thank you. So many of these patients from Life Care Center in Kirkland are being taken to Evergreen Health for treatment.
This afternoon, we got to speak exclusively to Evergreen's CEO about how the hospital is dealing with that situation. Ted Land is live there tonight with more. Ted?
Hi guys, we talked to Dr. Jeff Tomlin, who's had a very busy few days here at the hospital handling the coronavirus situation here. There have been some questions about preparedness. Is a hospital like this ready for an outbreak and for all the patients that were coming in? He says yes, because hospitals like his were prepared for the flu, and the precautions are very similar between the flu and coronavirus COVID-19. So he says a lot of those precautions were already in place. We had a wide-ranging interview about some of the precautions that they have here and kind of the inner workings of a hospital in the midst of this. Here's some of our conversation. There is some frustration within the medical community that testing is not widely available or fast enough. Does that frustration exist within your organization?
Oh, I think we would love to meet the population demand, because we get a lot of calls that can I be tested, and we just have to frankly say until we get those kits, we won't be able to test the general population. So I'd say that's probably our biggest frustration, but I understand that it takes time to get all those, and one day it'll probably be as easy as testing for flu, but for right now, as they're getting all those test kits out there, we'll await that and use them where we sure they're indicated.
Dr. Tomlin also gave us some information that the death toll will likely increase in the coming days. He says 11 people have died from coronavirus at Evergreen Health. Now, if you look at what we're reporting statewide on the death toll, it's 11 right now, and we know people have died in other locations. So once people die here, they are reported to the state, and then the state updates those numbers once a day. So expect those numbers to increase probably tomorrow. Live in Kirkland, Ted Land, King 5 News.
Ted, thank you. So a lot of talk about increasing capacity of testing. Those numbers will likely go up over the next couple of weeks as more tests flood into our state and across the country. So that wraps up our extended coverage of King 5 News. With the visit today of the Vice President, we'll have much more coverage of that, of course, coming up on King 5 News at 7.
NBC Nightly News is on the way next.